is Indian Country Today.
Esquili, yes, Thank you for joining us. I'm Patty Talahongva. Our newscast is devoted to the coverage of COVID-19 and its impact in Indian country. And we are learning as more testing becomes available. Of course, the number of cases in Indian country continues to rise. Let's bring in Jourdan Bennett-Begaye, our Washington editor, who can give us more information on the updates in the numbers. Jourdan?
Hi, Patty. Yeah. So as of yesterday or as of last night, in the Indian health system, we have a total of 1,114 positive cases within Indian country and a total of 39 cases. And again, I'd like to remind the viewers out there that these cases are the ones that are being tested and reported. You know, there's a lot of undetected cases out there that we know because of the lack of testing. And as the Navajo Nation President Jonathan Nez said, that these numbers are going to increase as more testing is available to tribal governments.
Give us the number of positive cases that positive tests that we've heard so far.
So as recently, the Navajo Nation, they had a huge increase over the weekend just because of their availability of rapid testing, which is the Abbott test, and so they get their tests within 15 minutes or less right now, and it's becoming available to 2 agencies in Navajo Nation right now. I know one of them is Chinle, and I can't remember the name of the other one. But also Colville tribes also saw an increase of a few cases. The Cherokee Nation saw an increase of 3 cases. But again, like, we are actively trying to go up there and seek tribes themselves, because there's tribal sovereignty involved, and we're trying to keep updated with our team.
All right, and the number of deaths related to COVID, what is that number again?
Yes, so there are a total of 39 deaths within the Indian health system right now. And so we at Indian Country Today are really encouraging, individuals or family members of these, deaths, that we really want to put a name to this a face to these pandemics, because right now these are just statistics, but Indian Country Today really wants to show people that this pandemic is affecting people. They're affecting Indian country just like the rest of America right now. And so people can send obituaries to Indian Country Today at no cost, and they can also send it to obituary@indiancountrytoday.com.
All right, so we're asking for information from people in their communities there. And how else is the pandemic impacting, say, for example, the census?
Yeah, so that's a good question, because the census actually just announced that they are encouraging or asking lawmakers to extend the legal deadline for the Census Bureau to deliver, this new state population count that is used for, redistricting and electoral college and funding reasons, right? So typically the deadline is December 31st. Now with this new deadline rolled out, they're asking, the Census Bureau is asking lawmakers for an extension of April 30th, 2021. And they rolled out all of these like other deadlines. So this new deadline will also extend the self-response phase to October 31st. So people will be able to participate in the census by phone, mail, or online until the 31st. And then just after that, enumerators or census takers will be, answering and going knocking on doors, asking people, for their information for the census. This also affects Alaska too. So, and they gave a tentative deadline for those. So right now, it will be happening. Actually, I had the dates right here right in front of me, but but all of this is like just tentative right now. These deadlines won't happen until congressional approval is received, because this is federal law, so they need approval from Congress in order for these deadlines to be set right now. But I did talk to Lorinda Sanchez from California, and she is the executive director of the California Indian Manpower Consortium, and she's really grateful for this 4-month extension, because in California, of their 109 tribes, about 98% of those tribes have a less than 15% response rate. And
so they're really going to be impacted by the census. So, okay, well, Jourdan Bennett-Begaye, thank you for joining us. We will continue to follow the census count and the impact that COVID has on it. We'll be right back.
This is Indian Country Today.
Welcome back. Our guest today is Regis Pecos, and he is the co-founder and co-director of the Leadership Institute at the Santa Fe Indian School. Thank you so much for joining us, Mr. Pecos.
Thank you.
Well, how are you doing in this pandemic? How is it affecting you personally?
Well, I think like everyone else, it's been difficult at all levels, at a personal level, with family, with community, and at the personal level or professional level with work and the magnitude of the challenges we face and trying to respond as best we can has been difficult using technology. And as limited as technology is in many of our tribal communities, it's an added frustration to the challenges we face. Thank you for asking.
Yes, well, all of us, we're working from home, we're doing the best that we can in our circumstances. And so it's, and if you're in a leadership position, I'm sure the phone never stops ringing for you.
Absolutely right on that.
Yes. So you were a part of a group of people who put together, tribal members who put together a tribal response plan to COVID-19. Who instigated that? Where did that idea come from?
I want to give total recognition and credit to Secretary Lynn Trujillo, who is an attorney from Cochiti Pueblo, who is the highest ranking Native American in that capacity. And New Mexico, of course, is one of the few states that has a cabinet secretary who oversees the Indian Affairs Department. And it really was her vision and that of her staff responding to just the multitude of questions from our tribal leaders who were, one, challenged with the response of something that none of us have ever experienced. But one of the benefits of something that the Leadership Institute accomplished was establishing a Pueblo PhD cohort 10 years ago that has graduated 20 Pueblo PhDs. And it really was the opportunity to call many of them who are now policymakers. Dr. Michelle Swina, as an example, is with the Southwest Epicenter. We have hospital administrators. We have a number of physicians, attorneys. So it was a really representative group that we were able to reach out at the request of Secretary Lynn Trujillo to, one, bring that kind of a brain trust that we have the luxury of calling, and that is something that the Leadership Institute does best as a convener. Over the last 20 some years, we have been able to put through our process of leadership institutes to build a network of, over 5,000 people across very diverse disciplines.
Well, that really speaks to this whole idea, as Indian people, we've always been told, go off, get your education, come back and help your people. So you really saw that come into play in this pandemic.
Yes, and one of the teachings, of course, is Dr. Carnell Chosa's grandfather, who one would always share with us that you can contribute from many different places and not just within your community. And as I listen to all of you and the work that you do, that's exactly what you're doing. And so this effort really epitomized that the many people that we're blessed to have in multiple places in the federal government, in state government, in the nonprofit sector, the private sector, in our communities, really epitomized true to what those teachings are, that when our people, when our leaders call, you can contribute from many different places for the well-being of our people. And that was the principle that we followed.
All right. Now, looking at where we are today and where the tribes in New Mexico were, say, this time last year, at that point in time, what kind of public emergency plan did you have? Was it pueblo by pueblo, tribe by tribe, or was there this kind of united effort to face a public emergency? And in New Mexico, what comes to mind would be maybe a snowstorm. So was there some kind of plan like that before this?
We're blessed with incredible leadership. And one of those leaders is Governor Michael Chavarria, who also serves as the chairman of the All Pueblo Council of Governors. And in his capacity, unfortunately, in his tenure as the governor of Santa Clara Pueblo, they faced some of the largest fires in recent New Mexico history that impacted their reservations, as it did mine, as it did Jemez Pueblo, and others. And as a result of the largest fires in New Mexico history, that experience in establishing emergency operation command centers with those fires, the scale, the magnitude of those fires, and then the subsequent floods that occurred really created firsthand experience. And Governor Chavarria, as a leader and a visionary, he had the experience of one of these largest fires and floods that threatened their community that really prompted he and other tribal leaders of New Mexico to amend the Stafford Act that provides now explicit provisions for tribal nations to declare their own emergency disasters as a result of that experience. And so it was with that backdrop and experience that the leadership came together with the Secretary of Indian Affairs to, one, expand from that experience to develop a comprehensive articulation and delineation of this response plan that the Secretary's vision created.
So those were those mutual aid agreements between, say, fire departments, both wildland and also municipal fire departments, police forces, all of those entities that come together to help in a public crisis?
Yes, and the magnitude of the threats of the fire and floods really prompted to engage in intergovernmental relationships with the federal government, obviously the state, the local county departments, fire departments, law enforcement, health care providers. So it really was, from an unfortunate experience, the good fortune that they could use that experience to move into something that we have never experienced with this pandemic, as is challenging every governmental entity across the nation and the world.
So, absolutely, it's as American Indian people, we have the history we have with the federal government and with germ warfare. It's not new to our people, and yet what stories do we have? So, example from your people, the Cochiti people, what stories do they have about facing this kind of pandemic in the past? And what can we learn from that?
There are many stories that elders teach and remind us that are in our life journeys, as they saw in their time and as told to them by other generations before them, that there would be great suffering of the people that was largely the result of our deviating from the original instruction and core values. And elders remind us that these times are times that we must reflect, learn lessons that come from tremendous suffering as we're experiencing. But central to that is the faith that has always been their strength. And one of the greatest challenges in this time of this pandemic with social distancing being at the center of what has been framed to be the best medicine for this pandemic. It is forcing us to deal with some very difficult challenges, that the strength of our people has been the close relationship of families, of clans, of communities. That has been our strength. And yet in these times, our greatest challenge is to be forced to isolate, to alienate ourselves from the very strength. But that is also a reminder of what it feels like when people are forced to be alienated from the strengths of their resilience and perseverance. And these are all examples that epitomize the truth to those stories, as elders remind us in this time.
So true. You know, our societies are by nature very social.
It's been incredible to hear the ways in which largely oral societies are now using new sources of communication that we have never really relied on so heavily. So the challenge and the response to these challenges for largely oral communities and societies, one has resulted in just incredible, ingenious adaptations in the use of technology. I'm reminded of what Governor Brian Vayo of Acoma did to use video as a way to communicate, using Facebook as a way to reach young people, to share the information that young people can then translate to family members in their households, to those who have access to radio, to television, as Navajo Nation has in many of its regions. They have really fully maximized the ownership of radio stations and TV networks. But these times have really called for incredible creative ways to enlist people across the entire spectrum and use their skills and talents to serve as messengers in multiple ways in our respective communities.
And was that part of the communications, was that a part of that tribal response plan to put together a real clear method of communicating with the people? And consider, you know, how you communicate with an elder is different than how you communicate with a younger person, you know, say somebody even in junior high, because those young people really probably don't quite understand.
Right. And, you know, the response plan really addressed multiple levels, from essential definitions and delineation of shared responsibilities with tribal nations, their operation command centers, with the federal government, with HHS, with IHS, with CDC, with the state, with the departments of health. And then at another level that is internal, between tribal leaders, tribal officials, their representatives on their command centers, messaging from those people. In many of the Pueblo communities, of course, we have the traditional forms of government where appointed individuals serve as primary officers in the secular government. So they use the traditional door-to-door messaging by word of mouth. And of course, language, our native language, is the primary communication in those instances. So the creativity of many internal in our communities have been heavily relied upon to address your very points, that much of the communication in the majority of our Pueblo communities and other tribal communities is through our own indigenous languages, and using people in our communities then to translate to younger generations of people in English, and using multiple communication skills and tools has been largely the way that there has been a full court press, if you will, in trying to communicate and educate people in all of the multiple ways, from understanding what testing is, what doubling means, what social distancing means, from interpreting test results, from the explanation of what this virus is about. It's a very complex undertaking from a kind of education approach, so that all members of our communities are fully aware that the adherence to all of the guidelines is absolutely necessary for us to fully maximize protecting one another from this vicious killer.
Right. So much to discuss with you, and but I also want to, there's such a heaviness around all of this, and it should be. I mean, it's a very serious matter, very life and death. But where does humor come in? Indian people, man, that's one thing that totally saves us in so many cases. Our sense of humor. Where's the sense of humor in this?
I think it's very central in Pueblo and tribal society. So it's ever present, and even in the darkest moments, from a purely cultural perspective, we have people who are committed for their lifetime to be members of societies whose primary role is one to lift the spirits in all that they do. So those teachings, those lessons, even in the most serious discussions, it's not a form of disrespect that an elder or a child or a young person will inject into a very serious discussion, that spirit of humor that lightens the heaviness and the complexity of what we're dealing with. So absolutely, humor must be what helps to balance the heaviness of what we're dealing with. And children, especially young people and elders particularly, have a unique gift to bring that kind of spirit to lift our hearts and to lift us physically, spiritually, and mentally, even in the most heavy and serious discussions. Someone inevitably will say something, and all of a sudden, everyone laughs, and we're brought back to the goodness and the spirit that even in these times, laughter is good medicine.
Well, very good. Very briefly, Regis, tell me, what's the biggest takeaway lesson tribal leadership has learned from this so far?
I think as we have recently recognized in our own communities, how far we are deviating from the defined core values that have been our strength, the core values of love and respect and compassion for one another. There's a long history that has created this reality, and sometimes the dysfunction that comes with this reality. If there is a lesson that elders remind us, this really is a time for deep reflection. One, to remind ourselves that the suffering we see also brings the goodness that is always and ever present, fighting with the bad spirit and the good spirit, and the original instructions as they teach us must always be to hold strong to our faith, to abide and adhere to the covenants of those original instructions and those core values that in this time of great challenge, we see some of the most beautiful demonstrated actions that make life a reflective sense of appreciating how beautiful it can be.
Very good. And that's so, again, that's so true that you're looking at how our core values as Indian people can carry us through this pandemic. Last thoughts, Regis Pecos, what's the big message you want people to take away from today's interview?
I want to say thank you to you and your staff, because, and it's emotional for me, because sometimes we don't have a voice, and sometimes we don't have the faces of our people in mainstream media. So when I hear your voices, when I see your folks who are out there becoming the storytellers on paper, and when we see the faces that you bring in these first efforts to both bring voice and face, I'm deeply touched that you've been blessed and you are the answers to our grandmothers and grandfathers who prayed that we would someday be blessed with what you share in the way that you share with your special gifts. So from the bottom of my heart,
Esquili.
thank you to all of you.
Esquili. Thank you, Regis Pecos.
Thank you.
At the beginning of our newscast, we reported the Navajo Nation had 813 positive tests for the coronavirus. They now say 2 more tests have come in positive, bringing their total to 815 positive tests for the coronavirus. We want to continue to bring you this coverage of the pandemic. You can watch our newscast on IndianCountryToday.com. We post at 4 p.m. Eastern Time. We're also on FNX weeknights at 7 p.m. Pacific Time. Take care of your lives. You're precious. I'm Patty Talahongva, Esquili. Thank you for joining us.
This is Indian Country Today.